Hi, we are Dimos Inspirit team from Poland and we would like to present you our solution ISIS. This is Agata Majewska, our graphics designer. Marta Łuczak from Medical University supervised our project. My name is Łukasz Michniewicz and I'm programmer just like Szymon Majewski, and our mentor is Tomasz Gdala, who supported us with his advice. 15% of all pregnant women worldwide suffer from potentially fatal complications during pregnancy. That makes 2 million women per year. Every pregnancy complication, when untreated, is very dangerous for mother health and can cause serious defects to child after birth. There is negative correlation between frequency of examinations and number of untreated pregnancy complications. So, by increasing frequency of examinations, we allow doctors to order proper treatment in time to save lives and health of women and their children. Idea of our system is very simple. We bring one of the most common pregnancy examinations to patients' home. This examination is cardiotocography.
CTG, cardiotocography, is a very important examination during the whole pregnancy. It is available only on the hospital ward or in a consulting room. During this examination, we can estimate fetus heart rate, uterine contractions, and fetal movements. In case of pathological diagrams, there are some possible causes of this state, such as fetus anemia, intrauterus infection, preeclampsia state, placental insufficiency, or beta-mimetics.
Main idea is to move CTG examination from the hospital to the patient house.
Let's take a look at the ISIS system from the patient's point of view.
Pregnancy is a very important moment in women's life when you should feel safe, happy and comfortable. Unfortunately, it's not always that easy, especially in case of endangered pregnancy. That's why we want to create a friendly interface that would appeal to women of all over the world.
To do a CTG examination at home, patient has to put the sensor on her belly. This is very important to find a place where signal is as strong as possible. Heartbeat detector helps to find that spot. The bigger the heart is, the stronger level you found. After starting examination, signal is being sent to the remote server at the hospital for analysis by expert system and medical staff. To avoid self-diagnosing by patient and false alarms which can stress her unnecessarily, application doesn't give any information but shape of the heartbeats. If woman has any doubts about condition of her child, she can contact with doctor by voice over IP or a chat. During the examination, patient can read ISIS guide for prospective mothers. She can find their forum, advices on lifestyle during pregnancy, tutorial movies or even list of shops with baby equipment. Examination is done. Now let's see what happens next. Our expert system has two tasks. First of all, it acts as a filter. When examination's result is normal, even nurse can give a patient a feedback, and there is no need of engaging a doctor. When the result is inconclusive or abnormal, expert system raises an alarm on the doctor's application, so he or she can decide which medical actions are essential. In extreme cases, expert system may suggest dispatching an ambulance to the patient's home. The second task of our expert system is to help doctor with the diagnosis. It's based on Raf's theory. Expert system is able to distinguish signals specific for certain conditions and suggest most probable cause of the condition. Expert system empowers doctors to minimize factors of distraction and tiredness rather than replace them. We cannot exclude doctors from the process as they have responsibility for the patients and they should make decisions on proper medical actions. Pass on to the doctor application. What we see is the timeline. Timeline is used by the doctor to order actions done by the patient at home. Those actions are examinations, surveys and notifications. On the first stripe, doctor can view results from examination. Let's see one of them. This is classical graph of CTG examination result. Most important part is graph of the fetal hatch rate. There is also graph of uterus activity. Doctors make diagnosis by analyzing those graphs. In the classic CTG examination, all results are stored on the roll of a paper, and doctor can make only eye analysis. ISIS stores results in a digital way. That's why we can support doctor by autonomic expert system to create report from examination. Thanks to reports, doctors make better diagnosis and minimize risk of potential mistakes. Medical literature describes three types of CTG examination results: normal, suspicious and pathological. Our expert system analyzes incoming results and automatically alerts medical staff on suspicious or pathological cases. Let's see an example. This green stripe indicates that one of the patients is online. As we can see, ISIS is detected as a suspicious signal. Doctor can view the result immediately and check if there are any reason to worry. After taking a look at the result, doctor can contact the patient and give her a feedback. Thanks to different levels of alerts, ISIS can focus doctor attentions on most severe cases. After analysis of pathological result, doctor can dispatch an ambulance. Let's go back to the timeline. Doctor is able to plan schedule of examinations, medical surveys and visits for the other checkups at the hospital. Planning examination by a doctor is very useful, because it prevents patients from making unnecessary examinations. Doctor can also create survey for our patient. This is very important, because some medications and food, like coffee, can affect examination results. Preparing a survey is very easy. Now let's go back to patient's home. As we can see, she's asked to do examination tomorrow morning.
ISIS makes use of many modern technologies. Patient and doctor application communicate with server using WCF, which can propagate web service, TCP and other channels. Server uses SQL Server and link technology. To get signal for our application, ISIS works with existing CTG devices, but we also created our own sensor. It is based on analog device microcontroller, which was programmed its assembly code. Thanks to the WPF technology and Microsoft Blend, our graphic designer could create nice looking interface in a very easy way. Aside from Visual C# language, we used C++, Microsoft Direct Media and FMET library to create our own voice over IP service. We also create mobile version of ISIS using Windows Mobile. Guide portal was created with ASP, Silverlight and Windows Live. .NET Framework 3.5 enabled us to combine all of those technologies.
That was ISIS, affordable and innovative CTG system for home use, which improves maternal care and helps reducing afterbirth complications.
Efekt, jaki chcielibyśmy uzyskać, mógłby być możliwy tylko dzięki udziałowi i roli w tym systemie zarówno pielęgniarek, położnych, jak i lekarzy, którzy biorąc pod uwagę ich doświadczenie w analizie zapisu KTG, mieliby możliwość weryfikowania i przesiewania zapisów. Wydaje się, że taki udział personelu medycznego w tym systemie mógłby w znaczący sposób przyczynić się nawet do poprawy wyników porodowych i zmniejszenia częstości najgroźniejszych powikłań dotyczących okresu bezpośrednio przedporodowego.
During work on ISIS, 3 of our friends gave birth to 3 healthy children, that is Zosia, Mateusz and Julia. We hope that you liked our work and see you in Cairo.